are going to be reviewing pelvic floor physical therapy and the management and treatment of endometriosis. I'm Dr. Kelsey Kossl. I'm one of the minimally invasive gynecologic surgeons here at NYU, and I'm a member of the Endometriosis Center. So we know that endometriosis is very complex to manage. A lot of times here in the office, we talk to you about medications or surgeries to manage endometriosis and the symptoms that it can cause. But a major goal of the Endometriosis Center in these webinars is to explore the whole spectrum of tools to manage endometriosis. So tonight we're really excited to talk about pelvic floor physical therapy, which we have seen help many of our patients in the treatment of endometriosis. I'm very excited to have with me Amanda Palmeri, who is a board certified women's health clinical specialist in pelvic floor physical therapy. Amanda works here at the Rusk Rehabilitation Ambulatory Care Center at NYU. The center is located here in Manhattan on 38th Street, and it has 7 full-time therapists in pelvic health. As an overview of tonight's format, I'm basically going to be asking Amanda some questions about pelvic PT and how it can help endometriosis so we can all learn together. We would definitely like to hear your feedback and questions, so please post any feedback about your experience with PT or any questions about physical therapy in the chat for us to address during tonight's webinar. So with that, Amanda, welcome.
Thank you. I'm so happy to be here.
So I think Amanda's wonderfully prepared a couple PowerPoint slides just because what we're talking about is, a really physical thing. So it'll help us kind of really understand what physical therapy is. But I thought a good jumping off question for you, Amanda, was just really, what is the pelvic floor? What are we even talking about tonight?
Okay, perfect question. I'll just start by giving a little bit of background on myself. I am a physical therapist. I am the clinical specialist in our specialty department, which includes pelvic health physical therapy. And, as physical therapists, we specialize in movement, body movement, muscle activity, muscle dysfunction. And our pelvic floor muscles are muscles like any other muscle that we have in our body. And that means that it has an ability to contract or to squeeze. It has an ability to relax. And just like we would address any dysfunction in either of those categories, our pelvic muscles are no different. And Dr. Kossl in the 1940s studied these muscles and found that, like other kinds of exercise, these muscles will respond to exercise. We can get them stronger, they can get weaker, and they can also be a source of tightness or pain, which we might see in the case of endometriosis. So I'd like to begin by showing just an image of where the pelvic floor muscles are, why they're important to us in pelvic health and in the setting of endometriosis or in pelvic pain, just to give you an idea of why maybe working with a physical therapist should be an important aspect of treatment and of care. Let's see if I can toggle. Here we go. So this first picture here, are you able to see my screen well?
Yes, we can see that pelvic floor.
Excellent. All right. So these are pelvic floor muscles that we are looking on, those red muscles that we see, and there are several of them. So we're looking at really the base of our pelvis. If we were to look down onto that pelvic cavity, which is the hole that we have, which encompasses a few of our pelvic organs, we can see that underneath them is what the pelvic floor muscles create, which is this sort of hammock or sling that helps to hold up our pelvic organs, being the bladder, the uterus, and the rectum. And as I mentioned before, our brain has control over when these muscles squeeze and when they relax. Now, we develop the ability to squeeze these muscles on command when we become potty trained, when we can feel an urge to go to the bathroom, and perhaps it's not socially appropriate to go to the bathroom, so we want to hold the urine in. And that requires these pelvic floor muscles to do their job and to squeeze, close off the sphincter of the bladder, close off the rectum so that there's no leakage of urine or leakage of stool. I also brought with me here so that I can show you my kind of 3D image, because what I'm able to show you here, and this is that same pelvic floor image that you guys are seeing there. It's that deepest layer of pelvic muscles. And I also want to show you that we have an outer layer of pelvic muscles as well. And I'd like to show you, even in my next slide, that our pelvic organs being the bladder here, the uterus here in the center, and the rectum, they live and exist in our pelvis, sitting comfortably, supported by your pelvic floor muscles. And I'll show you here on this next slide that from a side view, it sort of looks like that, right? The three of them hopefully are living amicably together, bladder toward the front, uterus, and then rectum. And your pelvic muscles are basically that sling that you have from your tailbone, your coccyx, to the front bone being your pubic bone or your pubic symphysis.
Great. Yeah, that's so helpful. You know, to see obviously those muscles that make up our pelvic floor, they sit in really close relation to all of our organs. You know, me personally as a gynecologist, when I'm seeing patients with endometriosis, you know, I'm sure patients are kind of wondering how endometriosis might actually impact those muscles or pelvic floor. We can see that they're sitting very close to our uterus, our ovaries. You know, when I explain endometriosis, I describe it, try to boil down the definition that it's endometrial tissue, which really should normally just be growing in the inside lining of the uterus. It spreads outside of the uterus and leads to deposits in the pelvis, such as cysts on the ovaries, and also just small lesions or deposits throughout the lining of our pelvis. So kind of on your model, they could be really touching anywhere on the back surface of the uterus, on the ovaries, on our ligaments, on the bladder, and on the rectum. And we obviously know that endometriosis itself is tissue, the tissue, it responds to hormones and it becomes kind of activated and irritated in response to our hormones that fluctuate throughout the month. And that process is really inflammatory. So to me, it makes sense that this inflammatory environment that's getting produced by endometriosis can affect the muscles of the pelvic floor that you just showed. Did I explain that well, Amanda? Like, how would you, if a patient kind of came to you and said, well, what does my endometriosis have to do with my muscles? Why is endometriosis affecting my pelvic floor?
Absolutely. It's a great way to explain it. And I would second that. In our pelvic cavity is small. And as I mentioned, we would hope that all of our organs are playing nicely in that small space. But when there's a presence of any inflammatory response, what we find is that the nearby neighbors can be affected by that. And so if there's endometrial tissue there, perhaps it's impacting the uterus, and maybe because it's in between the uterus and the bladder, perhaps the bladder is irritated by that. That inflammatory response, we believe, is part of the process that then affects the pelvic floor muscles. Those muscles are affected by that chronic inflammation that perhaps is cyclical. And as a result of that, the muscles themselves may react in a way that is leaning more toward what we would call overactivity of the pelvic muscles, and that being tightness of the pelvic muscles. Perhaps they don't relax fully. And as an extension of that, muscles that have increased tightness, just like we might have in our shoulders, just like we might have in our hamstrings, it's possible that some of that tightness can lead to some pain and discomfort. This is one of the current models that we believe to be the link between endometriosis and the experience of pelvic pain. And so I've tried to outline it here, very basic, how addressing your pelvic floor muscles may not be able to treat the presence of endometriosis, but it is able to affect pelvic floor muscles, which may be affected by the presence of endometriosis.
Yeah, it's one key in the puzzle,
yes.
Which makes a lot of sense. Okay, perfect. So, I mean, I think that's really well explained in terms of what are we talking about when we talk about the pelvic floor? How is it impacted by endometriosis? I would say the next obvious question would really be, choose, who are pelvic floor physical therapists? What's your background? And then kind of maybe after you share that with us, getting into like what the visits are like.
Yeah, that sounds great. I'm going to toggle through. I believe my next slide should be, yes, what are physical therapists, and specifically what are pelvic floor physical therapists. I mentioned before that physical therapists are movement experts, and we specialize in prescribing exercises based on dysfunctions that are evaluated at an initial session based on what someone is experiencing, whether it's the presence of pain, whether it's weakness, whether it's deconditioning, whether it's fatigue, and specifically pain, of course. And we use our evaluation skills of how muscles function and movement systems to identify what ways we can improve upon some of the things that we see based on whether it's muscle tightness, whether it's muscle weakness, whether it's an endurance component. So that's kind of physical therapy in a very brief nutshell. And pelvic floor physical therapists go through specialized training in order to address these specific muscles. I myself have a certification through our national organization, which is American Physical Therapy Association, who offers a specialized certification in pelvic health. It does require multiple hours of specialized training. It does involve several practitioners assessing us. We are trained in doing internal, both vaginal and, if needed, rectal internal exams. And the reason for that, and there are certainly ways that during a physical therapy session or an evaluation, I can observe how these muscles are, your butt muscles or your glute muscles and your skin. However, our deepest layer of pelvic floor muscles are functioning, how well they squeeze, and more importantly, how well they relax. Just elaborate further that the internal exam is something to be something that the participant is to explore that deepest layer of pelvic muscles. It is not a gynecological exam. There is no use of a speculum. It is just a finger insertion, but it is to identify if those muscles have tenderness, right? If I were to sort of press on my trap muscles up here, right, and they really cause pain or discomfort, it might let me know that those muscles are tight and perhaps they're holding some inflammatory response that I might be able to address, maybe with manual treatment, maybe with stretching. So an internal exam can be part of the experience of pelvic floor physical therapy. However, it does not have to be. And I just want that to be clear to everyone here. It certainly plays a role, but does not have to be. And we do also offer, if patients are more comfortable having a third person in the room or having a chaperone, then that is something that we're able to do for them as well.
Perfect. Yeah, that's actually the perfect segue, because really I'm sure many patients don't know what to expect when they come for their first initial evaluation with pelvic floor physical therapy. So if you could kind of, talk us through what the evaluation is like on that first visit.
Sure. Pelvic floor physical therapy is, and I'm just going to kind of go past this because I have a feeling we're going to come back to it. But if someone were referred for physical therapy, right, that initial session is really getting a full medical history on what's the path that sort of led you here. Many, many times it's been quite a path, right? So there's been a long history of, I have pain with menstrual cycle. I have pain with intercourse. I have pain or difficulty with internal exam. There may be some bowel or bladder issues. I've had a surgical procedure in the past for removal of endometrial tissue. I've had painful intercourse since my very first attempt. It's important for us to get all this background information. And that really helps us to understand what the body has been going through, what the body system has dealt with over the last several years. Many times, we have learned that someone who might be in their 30s, in their 40s, in their 50s has likely been dealing with symptoms related to endometriosis since their teenage years. And maybe it was not picked up on, maybe it was not addressed, but usually it's been quite a long time. And after we talk and talk some more, which is really, one of my favorite parts of the exam, is sort of getting a nice history and really understanding sequence of events, it would be to go to a movement exam, a movement assessment, and that being broad movements, spinal movements, leg movements, hip mobility, hip flexibility, getting an idea of, in general, physical activity, what kind of exercise are you involved in, how do these pain symptoms or cycles impact your life, whether it's your work life, your home life, your relationships, your romantic life, intimacy. And then beyond that would be an observation of your pelvic muscles. I mentioned before that I can get quite a bit of information from just a waist down observation of pelvic muscles, identifying when I ask you to do a Kegel, so a squeeze like you're trying to stop the passing of gas, and then relax, and perhaps repeating that a few times. It gives me an idea of how well the muscles work, how well they relax on command. That's an important part of it. And then again, with consent, then we would go to doing an internal exam. And I'm really assessing at that time, how does the squeeze feel? How strong is the muscle? How well does it relax? Is there tenderness as I get to where some of this deepest layer of pelvic muscle is? Because overactivity or tightness of these muscles, and I'm just going to show you because the lighting is kind of poor. I'm just going to show you the inside of it here. We know that these muscles have tender points that are very often linked to maybe endometriosis, and that we can address some of those tender points, and that gets us to help to reduce pain and reduce discomfort. The end of the session is typically discussing our findings. What did we find from today? What conclusions can we come up with that will help us determine what the next several weeks of physical therapy really should involve? And then we can go further into that as far as what we do in treatment. But that's kind of a snapshot of what a physical therapy evaluation would be.
That's perfect. That kind of led me into the next question I was going to ask, because you were talking about those tender points. For me, I read the physical therapist's notes. So I feel like I have a little bit of an idea of what some of the treatments are, but not great, not perfect. So I would love to hear about what you find to be the most common therapies used specifically for patients who have endometriosis and pelvic pain. I know I've seen in your notes, discussion of trigger points and kind of like desensitization of those trigger points. So kind of what does that really look like? What does it mean to desensitize something, or what are some of the other therapies that you work with the patients?
That's a great question. Very often patients have done some research and maybe they know a little bit about what pelvic floor physical therapy might involve, and that doing some massage or manual treatment may be part of our treatments. I mentioned earlier that if we were to kind of touch on our shoulder muscles, perhaps maybe some of our lower back muscles, and we can see that there is some tenderness there, it gives me a clue to could they potentially be a source of the pain or discomfort? And the way that I might do that with my internal exam is really just to identify very gently, is this area tender? Is this something that creates discomfort for you? I can also get a sense of how well the muscle sort of lets me give it some pressure. If it's giving me a little bit of resistance, it's telling me that there's some tightness there. Another useful tool that I might use is, does this same discomfort as I'm pressing here, does that reproduce? Is that exactly the same discomfort that you have sometimes? Maybe after you have a bowel movement, or maybe just before. Does this create pain anywhere else? As I press on this area that maybe has some tightness, does it create some lower abdominal pain or discomfort? Does it create pain on the left side of the abdomen? These are all important things for me to identify. And then of course, further, I can provide some massage or treatment during that exact session. We can maybe do some relaxation techniques with a gentle stretch of the muscle. And if that helps to reduce the pain level, that's an important thing for me to take note of, because it means that continuing on with that may allow us to have more carryover as far as long-term benefit. And if that internal exam or internal manual massage is helpful, there are ways that I can then demonstrate or show you how that can be done on yourself. One very important aspect of pelvic floor physical therapy in the setting of overactive muscles or painful muscles is relaxation. Very often when the body is battling pain for a long period of time, relaxation becomes a pivotal aspect in care. And relaxation should always begin with diaphragmatic breathing to stimulate parasympathetic nervous system activity. So deep breathing is a very useful tool that we might do during manual treatments. And I always start that from day one. That's the first exercise I give. And I always say, this is going to be probably the most important thing that you learn from me, is truly how to do proper diaphragmatic breathing. And I describe the breathing as being not only helpful in relaxing your nervous system, but also in physiologically what's happening as you take a deep breath in is your diaphragm pushes downward, and this is your pelvic floor muscles. They also are able to expand downward. The diaphragm and the pelvic muscles work together. So if I'm able to get good movement of the diaphragm, we're able to get better movement of the pelvic floor muscles with relaxation. Can I continue on? Do we have any questions yet?
We do have one question.
Sure.
And let me just bring it up. Whoops, sorry. So our question, which I think this is a great question because I wanted to address this at some point. The question was,
Yes.
do you think that it's necessary to have this type of therapy if you don't have any pain from endometriosis? I know particularly for me, just the first thing I thought of in reading that question, a lot of what we do in terms of endometriosis management is guided by patient goals. And patient goals are obviously dictated a lot by symptoms. So some patients come to us with endometriosis and have pelvic pain. Other patients come to us with endometriosis who are maybe trying to conceive, and it's a diagnosis that they came about in terms of a fertility workup. So those two different patients will have very different goals. And so my treatment, my management for them is going to be very different. In terms of where I could think that pelvic PT would still be of great benefit, even if there wasn't maybe acute pain issues going on, is I'm thinking of oftentimes we send patients for pelvic PT after they have surgery for endometriosis as part of their kind of recovery process. I don't know if you can speak more to that or just generally what you think in terms of the question.
Sure. A couple of things come to mind, which is, in the absence of pain, endometriosis can affect pelvic muscles that may result in changes in bowel or bladder function. And so that might be experienced as incomplete emptying of the bladder, or even urinary leakage that occurs because the pelvic muscles are not fully emptying. And that may be a result of pelvic muscle overactivity. So I would say that if there's no experience of pain, I think that's a wonderful thing, but just to discuss if there's any issues with emptying the bladder fully. I feel like I have to go back again soon after I've gone. I haven't been able to totally empty, or I have difficulty with having a bowel movement. I have to do excessive straining or bearing down. And why is that? That perhaps could be because pelvic muscles are not relaxing when it's time to during bowel movements. Painful intercourse, painful internal exam. Those are kind of the most common complaints. I would say if there are no symptoms there, if there's no issue, I don't know if it's urgent, but certainly you mentioned after surgery. I want to touch on the fact that these muscles may have some tightness and overactivity. And it's also very possible that these muscles need a little bit of exercise, that there could be some weakness here in these muscles. And in the setting of the muscles are recovering really well, the pain is very low or minimal, it may be appropriate to do some strengthening because we need these muscles to be strong. They have very important function. And therefore it may be beneficial, especially for those that don't have any pain. Maybe they're just post-surgery. And so strengthening could be appropriate if there's a sensation or feeling of heaviness or fullness within the pelvic area. And there may be a descent of pelvic organs. that's an appropriate referral for strengthening of the pelvic muscles.
Okay, perfect. I want to go back to, so we talked about some treatments. We talked about kind of, trigger points.
Yes.
I love that you talked about breathing and how it helps kind of, with the parasympathetic response, because that's another big part of this that I like to say to patients. At the beginning of the webinar, you said how we learn how to control and how to contract these muscles. But a lot of times for patients who have pelvic floor muscle dysfunction, there's been a little bit of an issue where they no longer have the ability to control contracting and relaxing their muscles, and their muscles are kind of in a constant state of contraction. And we know that there's nerves involved in that process. If it's a healthy pathway, those nerves should be able to send signals and say, relax. But kind of when that circuit gets overrun with pain, it's not uncommon that, it goes off the tracks a little bit and the nerves are almost just hyperstimulated. And breathing, it may sound very simple or straightforward. We do it every day, all day, but really targeted breathing exercises can be so helpful in terms of muscle relaxation.
Yes, I want to just elaborate on that in the complexity of pain and how the body experiences pain. And one of the things that we have learned is it's not always related to something that is physically damaged, right? Or something that is torn or something that is tight. Especially as pain is experienced by the body for a long period of time. And we studied that, we have understood that sometimes pain actually just becomes an autopilot. It just becomes a message that is sent over and over again. And we really have to do something that may help to stop that autopilot. And one of those things, the quickest thing to do, is deep breathing. It's really amazing how it has an ability to kind of stop an autopilot circuit in its track. And then beyond that would be, okay, let's also now address the surrounding tissue, that being the pelvic muscles. Let's get them to relax. Let's do some stretches for them. When we do lengthening of not only the pelvic floor muscles, which by the way, we see in that picture on the left in what we call a happy baby pose, right? She is lying down with her feet in her hands, right? The coccyx or the tailbone remains downward. This is a stretch position of your pelvic floor muscles, right? And if I were to flip that image and show her upright, she's in basically a squatting position. That is a lengthened position for your pelvic muscles. And so that is one way that we can help to enhance pelvic floor muscle relaxation, is in stretching positions. This one being happy baby pose. You'll see also underneath that, someone who's in that hands and knees doing a cat and a camel, right? This is more of a spinal movement, but we know that stiffness of the spine can also trickle down to tight abdominal wall, and that can lead to also tightness of the pelvic floor muscles. So moving your entire pelvis in a forward and backward position helps to stretch your pelvic floor muscles. I mentioned the massage being both internal, but can also be on the outside. As an example, our groin muscles have a very close relationship. Our inner thigh or groin muscles, which would attach here, those muscles have a very close relationship with your pelvic floor muscles. And very often there's tightness there that those muscles benefit from having some stretching, as well as having some myofascial release and some massage. You see that image on the bottom right is someone doing a myofascial release technique that we call skin rolling. That's often a technique that I might use on the lower back. I might use it on the front of the thighs, on the inner thighs. It's really a sort of pinching technique, but then I add some movement with my fingers. So it's a little sort of creepy crawly technique. It is a way to stretch tissue that is overlying the pelvic, that is overlying muscle, I should say, because we know that myofascial tension can also lead to pain symptoms. I want to also just elaborate further on the importance of a comprehensive exercise program, which includes aerobic activity. Aerobic activity being any activity that occurs for a period of time, whether it's 10-minute continuous activity, 20 minutes, 30 minutes. The recommended amount of aerobic exercise for a healthy adult is somewhere between 30 and 60 minutes for all or most days of the week. And that can, of course, be something that is built upon. You can begin with as low as a 10-minute interval. But I want to mention and stress that because it's a very important aspect of my intake when I'm getting information on someone's physical activity level. And the reason for that is we understand that exercise itself helps the body to calm and regulate itself. And so in addition to giving breathing exercises, I will always discuss the benefits of an aerobic exercise program, walking, jogging, biking, if that's enjoyable to you and it does not enhance any pain symptoms. But getting the body moving, getting those endorphins running is crucial. And then, of course, we can elaborate in saying that our sleep health is very important, making sure that we get 7 to 8 hours of sleep. So that our body has an opportunity to recover. These are all important when we talk about reducing the body's experience of autopilot pain.
Yeah. The physical activity, I think, is a great one. I'm just going to pull up some questions here too, because I mean, we know there's definitely research studies that have shown that increased physical activity can help with pain related to endometriosis. I think that incorporating it at the time that you are engaged with a pelvic floor physical therapist would just be even better because it'll give you the comfort of knowing that you're addressing the pain with the therapy in order to allow you to be more active, and then just kind of capitalized on the increased activity as well. So that's great. So let's take a peek here. We have some questions.
Sure.
Great questions, actually. So how long does an average pelvic floor therapy treatment plan last? And do you always have to maintain it? That's a big one. Is this something you do one time and you feel better, or you know, how many sessions? And is this something that patients should really be incorporating long term?
Yeah, that is a great question. For the most part, physical therapy evaluations are an hour, and in our facility, they are 1 hour or 60 minutes. And then treatment sessions beyond that first session can vary anytime between hourly sessions going forward. There can also be other places where sessions are 45 minutes. Our clinic has 30-minute treatment sessions going forward after that initial evaluation. And the amount of sessions, that's always a good question. You know, I can answer by saying the average amount that we know, and this is really from research to show that it's somewhere in the 12 range, 10 to 12. Most studies are looking at consistent physical therapy, working one-on-one with a pelvic floor physical therapist at least once, if not twice a week. And that has shown better carryover on the days that you're not in physical therapy, and that there's a consistency in the exercise program. So, you know, I always tell patients it's somewhere between 8, 10, and 12, but it really depends on how well we're able to get to the goals that we're looking for, whether that's starting a new exercise routine, enhancing an exercise routine, providing education on how to do proper relaxation techniques, how to do self-massage. And that's something that I'd like to touch on as well if we have time. You know, giving you all the tools that would be helpful in the next several weeks, months, and even years. And then is it something that needs to be ongoing? You know, my feeling is that physical therapy does not need to be ongoing. I think it's important to share and have our sort of intensive where we see each other for a few consistent weeks. And then it's okay. We've gotten to a place where we're able to manage things on our own. And we're always here, right? If something should happen in the future, maybe surgery is happening down the line, and then we need to meet back again, then we have an option to do that if needed. Doesn't have to be ongoing forever.
So it sounds like, and so 12 sessions, you know, if something's maybe occurring weekly or so, it's a couple months of therapy to see that maximum result, about 3 months or so. But it's similar sometimes to hormonal treatments that we're talking about as well, that you might start to feel better little by little as soon as you start, but that you're going to kind of hit your maximum benefit, with consistent use in a couple of months. So, so yes, you were talking about self-massage. I think there, I would say, if you could answer that, kind of what can, because I like the idea of, I like to tell patients, carve out some me time. We have our cell phones on us all the time. So set an alarm in your calendar for maybe even just 20, 30 minutes, every other day. Especially patients work from home now, just carve out that time. And if they're able to do that, could you talk about what therapies they can do at home by themselves? If there's any tools that could be helpful for them to do that. And then one of the questions in the chat here goes along with that about, is there a name for the specific type of breathing exercises that you would recommend, or any sort of tools that help with breathing exercises at home?
Okay. I'm going to take the second part of that first, and that's because I have the picture up here. So I wanted to show you that the way that I like to teach breathing, and I would also argue that there's not only one correct way. I'm really looking for a nice slow inhale, which creates not only chest breath or chest breathing, but also creates a little bit of an expansion below the chest. So this person is sitting with her back supported, which I find to be more relaxing than sitting on a stool that we might sit on during our day. If I can relax my back, then I'm able to really concentrate, my hand on my chest, my hand on my stomach. Go ahead, everyone at home, and try this. But if you concentrate on taking a nice slow inhale through your nose and really think about going slowly so that your bottom hand has some movement. I'm looking for not only top hand movement, but can we get the bottom hand to create some movement? And that's always a little different than what feels like our natural response. The natural response might be a little bit more of a top breath. And getting a slow inhale, which creates movement below the rib cage, is an important aspect of diaphragm movement. And it is the diaphragm that we are looking to move. It creates a little bit of abdominal movement because essentially it pushes down and it cramps up the abdomen. But we're looking for that diaphragm movement. That diaphragm is 360 degrees all around, right? It gets to your rib cage, it gets to your spine, and it helps to create relaxation and bring oxygen throughout your body. So that's how I would start with breathing. Sometimes it's sitting, by the way, sometimes it's lying down with your knees bent. Sometimes it's lying on your stomach because that feels like you can get expansion into your back. Sometimes it feels like lying on the right side because the left side needs more room for expansion. So I kind of change it up. And I encourage everyone to sort of change it up because it feels different in different positions, and it's beneficial to practice in those different positions. I'll elaborate further with the massage question. I discussed that during the session, if we do find that stretching of the pelvic muscles, massage of the pelvic muscles, which, by the way, my massage is really with just a finger and maybe finding an area that's tender. And then I might just really move my finger. I might just press and hold my finger in a certain position. That may create a gentle stretch. And of course, I'm keeping track of, is this okay? Is this a level of discomfort that's manageable? Can we do some deep breaths here? And I notice if the muscles can relax. But I might also do a little bit of sort of back and forth. If we find that helps to reduce pain, then I might suggest a way for you to do self-massage at home. It can be with a partner if you feel comfortable teaching the partner how to do self-massage. However, there are tools that we now have called the TheraWand that sort of have this nice little curvature to make it easy to insert yourself with the use of lubricant. And that because it's has an angle, you're able to turn it and get to that same area that I was just at. This introitus is a little bit small, but I'll just show you that if we're able to insert, we can then perhaps do some of that gentle massage on your pelvic muscles when the wand is both inserted and then rotated or turned to where your muscles are, which are on the right and left side of the body. So this has become a really nice tool, thanks to a pelvic health physical therapist, that can be utilized at home. It also has a more narrow end. If maybe this looks a little intimidating for some people, this opposite end can be used as well. Wash it so that it's clean, and then it can be used again, whether it's once a week, twice a week. It allows for the muscle to have more exposure to a lengthened and relaxed position, and that can be useful for helping to reduce pain.
Perfect. That's an amazing tool for patients to have at home if it's appropriate for their treatment plan. So that's great. Well, we have, I think, just a couple minutes left.
Sure.
I think we have two questions that we've hit on a little, but just to kind of close them out. The first one is just, for patients who are doing pelvic floor PT after surgery for endometriosis, how soon are you typically seeing them? I know some of us providers here do send over to you at the rest center post-operatively. So kind of how soon after surgery are you normally seeing patients after for pelvic PT?
I don't know if there's a set benchmark. Of course, we really want at some point to be able to do an internal exam. And with any kind of procedure, if it's appropriate, we usually will give ourselves 6 weeks, right, in order to allow someone to have healing. Maybe we can do some breathing in the in-between. Maybe we can go over some gentle stretches, but typically nothing would be done internally, and any other benchmarks for that?
I would say generally, we would obviously, we would let you know if there's any significant limitations based off of the type of surgery you have. If this is something that, if learning about pelvic PT has been interesting to you as a patient and you're somebody who's in the preoperative process, I definitely don't think I think it could be very helpful to actually establish a relationship probably with a pelvic floor physical therapist preoperatively. As we've discussed tonight, there's so much to be learned just from if you just even started with stretches and breathing exercises, to kind of learn those core concepts preoperatively. And then those are something that you could really initiate once we see you for a post-op exam and we kind of have you all cleared for stretching, which would be pretty soon within a couple weeks after surgery, then those are things that you can start really almost immediately after surgery, and it could help with your post-operative healing process from a pain standpoint. So that could be really good. And then we're just almost at time. So very last question, which I think you've addressed, but just to make sure the muscles of the lower back, is pelvic PT helpful? Are you somebody who can also address lower back?
I would say absolutely. Absolutely. Your lower back muscles holding tension absolutely can be something that results from pelvic floor muscle tension. Same thing with the abdominal wall. I feel as though I haven't mentioned enough that pelvic floor muscle exercises, both the ability to squeeze and the awareness of how to relax, is an important aspect of treatment. And so in talking about pre-surgery, it may be helpful, right, to improve awareness. This is where your pelvic floor muscles are. This is how you squeeze them. This is how you relax them. That can be an integral part of just bringing awareness to an area, which is the very important step in improving any kind of function.
Yeah. Okay, perfect. Well, any last minute thoughts from you, Amanda?
It's been a pleasure to discuss the, pelvic floor physical therapy with you guys. I hope it was insightful. I hope that it helped to answer some questions that you have. And please feel free, if you have any other concerns, you can always reach out to me. I'm at NYU, and I would love to work with you. So hopefully I'll see you guys in the future.
Wonderful. I think I feel like 45 minutes just cruised by. We could probably keep talking about pelvic floor therapy for another 45 minutes. I think we have hit on so many great topics tonight, just from the basics of what's your pelvic floor and how it can be impacted by endometriosis, as well as, what is this whole field of pelvic floor physical therapy and how it can help you. We really, spent just a portion of tonight talking about the therapies and exercises. So I hope it was a good peek at what could be helpful for you. But obviously, just seeing a physical therapist, getting a consultation, I think is a great first step in knowing what treatment plan specifically could help with you. So thank you so much, Amanda. And this webinar will be posted online. So if you enjoyed it, if you have friends or family members who also are seeking treatment for endometriosis, it'll be available there for them to look at as well, or for you to review again in the future.
Wonderful, my pleasure. Thank you so much.
All right. Have a good night, everybody.
Good night.